Hello and welcome. This is Oles Gerjuk with UATV broadcasting from Toronto, Canada. The Ukraine Reform Conference is taking place here, so our team, in cooperation with Agri-Team Canada, is launching a special series of interviews about the current stage of Ukraine's reforms. And today we would like to discuss the ongoing initiative 100% Live. This is a clinic for people living with HIV, and we're going to discuss this with Anastasia Deeva, CEO of 100% Live. So hello and thank you for joining us.
Hello, thank you for inviting.
Thank you for being with us. It's a pleasure to have you here in this studio and also in our studio in Kiev. As always, you're an often guest there. So could you please tell us what is unique about this clinic?
About what?
What is unique about the clinic?
So let me start from the beginning, and I will explain what means when NGO provides the services for patients. Our organization is the biggest community-based and patients organization in Ukraine. We have the representatives in each and every oblast of Ukraine, and our main aim is to save lives. We really think that in the time when the epidemic is growing, when we have almost 300,000 people who live with HIV, and only 60% of them know about their status. We have plenty.
So basically every second, half of them do not know about the status.
Exactly. So we feel as our main mission, first of all, to help people to overcome the burden of afraid of knowing about their status, and to come up to their family physician,
and
to
be
NGOs,
judged. And to feel
not
judged.
to be judged, exactly.
Yes.
Not to have this discrimination and stereotypes, and to be tested. Because in HIV, nowadays, we don't have negative scenarios. Otherwise, it's positive or negative. You can receive a treatment, and you can live a healthy life,
Yes.
do the family planning, and to be an absolutely full
Normal,
citizen
full
of the
life.
country.
That
So
is true.
we believe at the patients that our experience working in Ukraine for almost 15 years, providing such services for more than 100,000 patients in Ukraine, can be very valuable for the government. And we do support the reform, which is absolutely patient-oriented. For the very first time in the history of Ukraine, the Ministry of Healthcare is providing a patient-oriented reforms, and we do support it, because we do believe that when we have the e-health system, which is absolutely transparent and consolidating all of the patient's history, all of the family physicians be integrated in this, and medical health facility to be presented, it makes the services of medical, social, whatsoever, be more transparent and operative for the patients.
So now we're talking about a completely new approach that the Ministry of Health is cooperating with non-governmental organization and basically is ordering the services, providing services from the non-governmental organization, right?
Absolutely. For the very first time in history, government will procure social and medical services from NGOs, because we do believe that markets of the services should be open for business, for NGOs.
Yes, because then it will raise the competitiveness of these facilities.
And will provide more high qualified services for patients who need it.
Okay, speaking of services, in this clinic 100% Live, could you tell us more about them? What kind of services does it provide?
So let me speak about our medical center. Our main idea was to open a first community-based hospital or medical center for our patients. The main mission was to provide these high-qualified services for key population groups, such as people living with HIV, LGBT community, and many others. So to make it more transparent and open for them, and to have 100% tolerance towards them.
So meaning more secure.
Exactly. So we opened this first medical center in Poltava, and later on, in 2018, we opened the medical center in Kiev, which was, by the way, opened by Sir Elton John, and we were very excited because, as being community-based organization, it's really needy to show that our qualified expertise, our qualified services
being
can be needed and can
recognized.
be recognized, exactly. So our main idea is to open our medical centers for everyone. It includes general population, key population groups and their relatives, their families, and we can be open for anyone because we have lots of patients, clients who are coming as a general population to sign their declaration with a family physician in our medical center, receive vaccines, receive consultation, family planning, etc. But the core idea is to provide more than 60% of services for free for key population. And that's what makes our medical center
Key
very
population.
special.
Could you specify what means
Of
key
course,
population?
it's vulnerable communities who live in Ukraine, such as people who live with HIV, LGBTI, sex workers, and also people, drug addicts, and many others. So those communities who may be more vulnerable to HIV epidemic, and unfortunately who nowadays still has to face a very discriminatory attitude toward them.
They're
And
being they're being cured free of charge. I mean, they are being provided with
Some
services.
some
free
of the
charge.
list of the services are absolutely free for HIV positive patients, such as testing, treatment, and many, many others, like consultation, diagnostics, and many others. So what we want to do is we want our patients with HIV positive status not to stand in lines in the AIDS centers, not to waste money for the road, for the queues, for the corruption, petty corruption, and many others, but to have a dignified services to be provided for them in a very convenient way. Because, for example, our medical center in Kiev is just in downtown. So basically a person in downtown. So basically a person can take a subway and in 2 stations be in the medical service. And what's more, he or she can sign online because we as an NGO are developing innovative IT solutions how to minimize the human, let's say, human attitude towards who will be the
Judgmental
first or
attitude,
not.
something, yes.
So you have an online registration, you can sign up any services you want to receive and come up on time.
And also, I do know that you have some confidential services that the person who is living with HIV can
Absolutely.
come to the clinic and not without being seen by anyone, any other patients. So basically, this is like strictly confidential, right? This is a
Yes.
great achievement. I think this is a great innovation. But for better understanding of our international audience, maybe you could provide us with some kind of example, maybe some kind of story. What is the difference of stories, I mean, of the approach to the patients in the AIDS center and in your clinic?
The very first example that comes up to my mind is, of course, standing in lines. Because, for example, if an HIV positive person is living in rural area and the AIDS center in the city, so he or she is spending like money, spending time for getting to the city center, standing in lines because sometimes the AIDS center is overcrowded with the patients and some of them are waiting for 6 and 8 hours just to get the prescription for antiretroviral therapy. And we believe that this is non-acceptable. And if government, business, NGOs can provide any other solutions for our clients to have this, attitude toward them with a dignity, we should provide it and to present it to government and business. If we as an NGO can do a social enterprise, why can't you do it?
That's true. But what kind of challenges do you face in your work?
There are always
I know that
lots
not
of
everything can be
challenges.
smooth, yes.
Absolutely, but I think the very first challenge is that we as a patient-led organization, we do support the new reform, which is led by Uliana Suprun, and we do our best to complement it and to fulfill the gaps which are there. And we believe that in the new political cycle, the reform will remain because those achievements which were accomplished during the leadership of the team of the Ministry of Health should remain and should stay because they are patient-oriented. And we believe that if that will remain, we will move forward and move forward quicker. So the second challenge, and of course, it's always investments, because we are a passionate organization, so we are NGO. And the very first stage, when we started to open medical centers, they were supported by donors. But now we're standing on the line when we need to start to reinvest our resources to scale up this project, to introduce to different cities that this is possible. And
to open the chain of the clinic.
Yes.
And who are the donors of your organization?
So we have many donors because international...
The main ones.
It's a global fund, it's USAID, it's CDC, it's a French foundation, 5% initiative, and it's also Olena Pinchuk Foundation on Anti-AIDS.
Well, the thing is that, as far as I know, the Global Fund is withdrawing from Ukraine, right? And it just launched the last extension covering this summer, the last extension of its operability in Ukraine. So if it is one of the main donors for 100% clinic, what are your thoughts on that, and what are your plans on solving the issue, where to get the investment? Maybe somebody can hear us with this interview, and some other foundation can also provide the assistance.
So first of all, Global Fund is not investing into clinics. Global Fund is investing in three main recipients in Ukraine, such as Center of Public Health, Alliance, and our organization, to make the transition plan, which I was talking about, when government is starting to procure services from NGOs. And it's extremely important process which has started. So we don't expect anything to be changed. It's about sustainability. It's about how all of the years of work and support for this donor can be accomplished and sustained by the government. So we are ready for that process, and government already started to procure services from NGOs. Secondly, is that, as I told you, social enterprise, the main idea is that all of the profit that can be gained by vaccination, for example, in the clinic, or by additional services that can be provided, it is reinvested in the scaling up of the social enterprises in different cities, but also reinvesting into the main goals for patients. So what can make patients' life, for example, with HIV, better, easier, and more fulfilled?
Well, social entrepreneurship is like a mindset, and as I heard, you have your own initiative as well. Could you please tell us about this? It is called Raw Law, right?
Yes, that's true. Because I believe that really social entrepreneurship is a mindset. When you think about how I personally can contribute to the wellness of people of my country or local community. So jointly with my friend, we started a small eco initiative introducing the alternative for the plastic bags. So very the same, because you know that Ukraine is overloaded, the shops are overloaded with plastic bags, which are absolutely disastrous influence on the environment, on the oceans, on the rivers, on the soil. So we started it and wanted just to show that we don't have the time for this. This is our side project, but we can show you that this can be fashionable, this can be cool, this can be
useful, yes, and eco-friendly, yes.
Absolutely.
It's just a matter of idea and your will to implement this idea, right? So, and please maybe just explain the audience a little bit more. What kind of materials do you use for that, and how big is this initiative? You've just started or not?
We started it a year ago as a hobby. It was fun for us to do because my partner in this is a close friend of mine who is working in an international organization. So yeah, you were right. It's a mindset, it's a culture, and we decided, why don't we try to do it for our friends, to introduce them that they can use not only this Eko Torba, but to use something innovative, something cool, like a paper, but not. So basically we started to procure material from Europe, which is certified, which is safe, and which is almost like a paper, but not, and started to present it for Ukrainian communities.
This is very nice. So as far as I understand, once you start taking care of somebody, right, and caring for people, you cannot stop. You
Yes,
cannot stop.
that's true.
This is also a mindset. Thank you so much, Anastasia,
Thank
for
you.
these comments, for our nice conversation, and thank you so much for being a guest today in the studio.
Thank you.
That was Anastasia Deeva, CEO of 100% Live. Thank you so much, and stay tuned with UATV as we continue covering the effectiveness of current reforms in Ukraine.